Here comes the sperm. 6 days. Ovulation at day 14, and the sperm is waiting. How many sperm are we talking about? A few hundred. Really? Wait, Dr. Rizzo, hold it. I've learned in my life that the ejaculate is millions of sperm. That's true.
They die.
Millions. But they die like dogs. They are tiny little things. They have virtually no cytoplasm. An egg has between 200 and 400,000 mitochondria. A sperm has about 70. Not 70,000, 70. Just a few in the tail to get the tail going. We'll talk about this next time. They're actually in the mid-piece, but they're just for the tail to get going. There's no mitochondria. They have virtually no cytoplasm. They're pathetic. They can't, they would die without nourishment from the fallopian tube. So, also, they hate acid, and vaginal secretion is acidic. So a lot of sperm just die. Now here come all the sperm. Half of them are going to go the wrong way. Because they're from men who don't know enough to ask for directions. They're going to be dead. Just dead. They're dead. The other half have to get up here and they're fighting all kind of stuff. They're fighting peristalsis, which is trying to push them the other way. They're fighting the little cilia that are waving to try to get them to go the wrong way. They don't, the only nourishment they can get is what they can get from the leaking out of the fallopian tube. So you start off with millions, and you end up with a couple hundred that finally make it to the antrum. And then here comes an egg. And this, you know, the sperm. Hey, baby. And the sperm. I look forward all year to being able to say that. The egg gets fertilized here. And it starts its 6-day journey to the uterus. Now remember, during this time, the uterus, under the increasing influence of estrogen, is thickening the endometrium and increasing the blood supply and increasing the resistance of these vessels so that lots and lots of nourishment is in this extremely lush endometrium. By 6 days, this thing is now, it's an embryo, basically. And when it falls into the uterus, it's already making hormones. And it will, hopefully, it will attempt to, and hopefully will succeed, to implant itself into the endometrium of the uterus. Biologically, when implantation occurs is when pregnancy has begun. I'm not talking about morally, I'm not talking about ethically, I'm not talking about some religious issues. I'm not talking about things we talk about in biomedical ethics. But if biologically you're ever asked, when biologically does a pregnancy begin, it begins at implantation. If that is ever the question. Now, if you want to take my biomedical ethics class, this is a commercial, which I would love to see you in my